Um, Brilliant. Thank you, B. Okay, then. So, as I said, yes, we commissioned this research. Really wanted to get a better understanding of the kind of needs and prevalence, really, of women who are sex working across Greater Manchester. And this is kind of really linked to the fact that MASH as an organisation is kind of in a bit of a transition phase at the moment. Well, it was back in sort of 2019. We were kind of thinking about where next for MASH and kind of how we could really kind of bring our specialist gender and trauma informed support to work in partnership and to enhance work that was already happening, but certainly to reach more women who are sex working. And then, of course, something quite significant happened in March 2020, which kind of took us slightly off our kind of plans in terms of our where next, but really gave us an opportunity to, I think, the pandemic really, it was two major things that happened for us around the pandemic, really. One was that women were disproportionately affected by what happened in the pandemic, and particularly those women that we support that are kind of at the real sharp end of kind of vulnerability and inequality, really, as women who sex work and experiencing multiple disadvantage. So it kind of really, broaden those kind of challenges and inequalities that women face. And I think secondly, it really brought sex work into more focus. And I think it really kind of, a lot of mobilisation happened in Greater Manchester, a lot of support, particularly for homeless communities and how we could kind of support those experiencing multiple disadvantage and had kind of different health kind of inequalities or exceptional kind of health needs. And we really kind of came together as a city region to look at how we could support people experiencing multiple disadvantage. So what that did was it really kind of brought, I think, sex work more into focus and more into the fore. And certainly as an organisation at MASH, we worked, with a lot of kind of partners and in that kind of mobilisation space to try and obviously deal with the pandemic and to really think about how that was impacting the people that we support. So those kind of two things, really. The pandemic, even though it was an exceptionally challenging time for all of us for so many reasons, of course, there are always positives, and that kind of really gave us an opportunity to kind of find out what was really kind of going on and how those kind of issues are being exacerbated by what was happening during the pandemic. So we shared that learning as well through doing this research. And yeah, as I said before, we really want to think about where next for MASH. So, what we want to think about, how can we bring our gender and trauma-informed specialist approaches to support more women and to enhance work, amazing work that's already happening across Greater Manchester. So that was kind of the key reasons for us putting together this research. And we, as I said, we commissioned some independent researchers to do the work, and they came in quite early on. And what we really did with them was that we got them to work with our service user advisory panels. We have a really strong group of women who are currently accessing services in Manchester, who are have lived experience, who are sex workers, and we worked with them to develop the research questions and to kind of test out what was going to work and what was, women could what we could try to get out of the research, and really clear on what those kind of asks were, which Bill will talk to you more about. And really kind of quite unusually, the first kind of part of the research was a literature review. And so we had an independent researcher who looked at kind of current literature around sex work, and particularly women who sex work in the UK. And it was quite a patchy situation. You'll have seen from the invitation that you had to today's event, we've probably spoken to a significantly large proportion of women who are sex working through this research. And it's quite an unclear, quite a lot of grey areas around kind of sex work in the UK. There's lots of different kind of thoughts and ideas around how it should be legislated. It's quite, it's kind of how sex work is kind of viewed, or is certainly kind of things around kind of the illegalities around sex work is quite different depending on where you are in the country. So it's quite a kind of a grey area in terms of kind of how we talk about sex work, I think, in the UK, and quite a lot of kind of polarisation in terms of kind of views and how people think sex work should be legislated. But really interestingly, in all of the pieces of research the literature review looked at, I think there was only one of them that had some asset-based questions in it. It was all very much deficit-based. It was all very much about what are the problems, what are the challenges for women that sex work. So we were quite unique, I think, in our approach. So we actually asked women what they wanted and what their kind of hopes and dreams were of, what they kind of wanted out of their lives. And that's very much MASH's approach about how we work with women to set their own goals and to think about, what they might want to sort of change about their lives, or how but very much kind of led by women themselves. But a lot of the women that we spoke to were really quite shocked that we were asking them that question, because they're very used to, when they're working with services, being asked about kind of what the issues are you know, what their kind of challenges are, what their problems are, if you will, and not kind of what they want. So that was quite a kind of unique place for us to come to, and we found out some really, really helpful information that sets us up for you know, our next kind of stage of this research. So what are we doing with this research? So the main thing really is that it's helped us to really underpin our next 5-year strategy at MASH. I'm going to give you a date. It's the 15th of February. We are hoping to launch our new strategy on that date. So I'll send you some more information about that, hopefully this side of Christmas, and certainly get the save date in your diaries. But it's really helped us to formulate where next for us as an organisation, and how do we best place ourselves and work with partners to enhance work across Greater Manchester to get better outcomes for women that are sex working. So the research has really helped us to develop that and to kind of underpin what we're doing, and independent research kind of backs up where we think we need to go next. So without further ado, I'm going to hand you over to Bea, who's going to go through the presentation with you. And then, as I said, there'll be questions available at the end. So thanks so much, everybody.
Thanks, Annie. I'm going to share my screen now. Can you see that? Yeah.
Yes. Yeah.
Brilliant. Okay, so just for context, the research report that was put together, I think it's 90 pages long. So I'm going to try and do a quick summary of some of the most interesting key findings in the next sort of 40 minutes. But it doesn't by any means cover everything, and it's probably quite a lot of content. So I'll try and go quickly and cover as much as I can, but we'll see how we go. So this is what we're going to go through. Annie sort of covered some of this, but the research project began in March 2021 with 3 independent researchers, and these were the key research questions that we posed to them. So they were: what different cohorts of women are sex working in Greater Manchester? What is the prevalence across the boroughs? What are the intersectional needs of the different communities of women? How are services in Greater Manchester meeting those needs? And where are the gaps in service provision or lack of specialist service provision? So like Annie said, the first part of the methodology was a literature review. And then we also had some primary research. So we spoke to 151 women who sex work, which is one of the largest studies that's been done in the UK with women. And we also interviewed 10 women in depth. And we also had a sort of stakeholder aspect. So we had a survey of 56 stakeholders and interviews with 4. So probably lots of you were part of that. So thank you for your input as well. And as Annie mentioned, the Service User Advisory Panel were kind of scrutinising the methodology throughout, making sure that they were comfortable with the questions we were asking and the methods we were using. So that is a brief overview. In terms of the prevalence and cohorts, this is a very challenging question to try and answer. Like Annie said, sex work is a hidden population. The research is limited, and the ways of kind of trying to build up the evidence is very challenging because of the nature of the work and the nature of the legislation and that situation. So there isn't any amazing estimates for this, but the most recent and the most accurate one estimates that there's around 100,000 sex workers in the UK. That's the sort of biggest ever study that's been done, suggests that. And based purely on population estimates, we can get therefore an estimate of 3,000 sex workers being in Greater Manchester. We think this is an underestimate because other parts of the research show that sex work is concentrated in big cities and also in areas of deprivation. So with 5 Greater Manchester boroughs being in the top 20 most deprived boroughs in England, I think, you know, that's means it's very likely there's a much higher number than 3,000 sex workers in Greater Manchester. But that's kind of a lower bound we could view it as. So within this research, we were also able to kind of get some lower bounds, I suppose, in terms of the number of sex workers in each Greater Manchester borough. So this table on the left is showing the number of women we spoke to from each borough who were resident there. So the numbers are quite small. Obviously, it's a small scale study, but what it does show us is that there are definitely women who live in every Greater Manchester borough who are sex working. And similarly, this table on the right shows where in Greater Manchester people sex work. And again, for every Greater Manchester borough, people are sex working there. So we know it exists everywhere in Greater Manchester. In some parts it's more obvious or more known about, but it is happening everywhere. So I think that's a key finding at this stage. Manchester came out as definitely the kind of hotspot within Greater Manchester. So 66% of the women we spoke to were sex working in Manchester. And the majority of people were sex working in more than one area. And a lot of them said that they preferred to go outside of where they live to sex work. So sort of concerns around privacy. They didn't want to be sex working too close to where they live. So in terms of who are sex workers, what are their characteristics? This is what has come out of the literature review. So it suggests that the majority of sex workers are women, slightly lower than you would expect being white British, higher than you would expect being transgender, gender fluid, non-binary or agender, and higher than average in the younger population. So some of that was matched by our study. Similarly, we found it was mainly younger people. In Greater Manchester, through what we reached through this study, it was a higher proportion were white British than what previous studies suggest. And from our research, we also found quite a high percentage who had long-term health conditions. So there's a bit more information here about sort of cohorts of women. This shows the length of time women have been sex working. So the most common was 1 to 2 years, 38%, and 3 to 5 years, 30%. So I think this shows us that it's not something people kind of drop in and out of. It's quite a long-term activity for a lot of women, and some even sort of more than 10 years they've been sex working. Bit of additional narrative about the actual cohorts in Greater Manchester. So in terms of street sex working, this was kind of reported by one stakeholder that the majority is undertaken by British women, many of whom have addictions, and there's also a cohort of Eastern European women working to provide money for the families. So this definitely reflects what we see at MASH and the groups that we typically work with. So in terms of what the actual different types of sex work are, some of you will be absolutely familiar with this, but for those of you who aren't, these are sort of ways that we categorize sex work. So survival sex work is undertaken to survive, and often sex is exchanged for food, accommodation, drugs, etc. Street sex work undertaken in public places and often in cars. Opportunistic, so unplanned when the opportunity arises. Indoor sex work, so this is typically in massage parlours and saunas, usually in groups and establishments that run like businesses. Escort work includes a range of activities and perceived by many as employment. Online sex work, so this includes both contact and non-contact activities, but also includes the sort of webcamming and activities that are only through the internet. And then sexual exploitation is, of course, different from those. So this is defined by the individual's lack of control and includes trafficking, modern slavery, and child sexual exploitation. And in terms of, I suppose, the difference in experiences between these types of sex work, this table kind of summarizes what the opposing experiences are and how that might sort of change a woman's experience of sex working. So how much control they have over the situation, what the level of risk is, whether it's indoors or outdoors, public or private, whether they're on their own or with others, whether it's face-to-face or online, contact and non-contact, and paid and unpaid. So you can see there's kind of like, you know, a scale as to which these might be more traumatic or more difficult experiences to undertake. In terms of the women we spoke to in this study, we found that street sex work was the most common, followed by sauna working. So 77% of the people we'd spoken to had street sex worked at some point, and 36% were currently street sex working. That may be a reflection of who we reached rather than the general population of women sex workers in Greater Manchester. But it certainly shows us that there's a large population street sex working and sauna sex working. And interestingly, a lot of people sex work in different ways. So they're not just doing one. Most people are saying, I'm doing this one thing now, but in the past I've done sort of several different things. So in terms of COVID-19, as Annie mentioned, this did have an impact on women in lots of different ways, but in terms of their sex work, people said it had decreased the amount of work they were able to find and affected their income. In terms of how that had affected different types of sex work, it basically affected all of them. All of them said that it had decreased the amount of work they were able to do. The only one that had slightly increased was online sex work. Some people said that had increased a little bit during the pandemic. And other comments were around it being less safe on the streets because of it being quiet, fewer punters around, and people being scared of getting the virus. So in terms of reasons for sex working, this wasn't a question we asked in the research, but quite a lot of information came through from the comments and the interviews around how and why people had sort of entered into sex work. So there was often an element of coercion, either trafficking, groomed into it as a child, or by an abusive partner. For many, it was around addiction and raising money for that, sometimes in exchange for items. Some people talked about their childhood or teenage years and that kind of leading them on a route to sex work. So maybe growing up in care, having parents with substance misuse issues, having experienced sexual abuse or domestic violence at home. And then others talked about really the economic factors, so just to pay rent, bills, to support the families. And for some women, it was about not having a legal right to work or not having recourse to public funds, and therefore sex work being sort of one of the only routes available to raise income. And just some quotes here as well. Okay, so we'll move on to looking at the needs of women. So there's absolutely loads here. We'll start with kind of what came through the literature review and then move on to what came out of our primary research. So from the literature review, there was kind of three main areas I think that came out as areas of need. One of them being safety and safeguarding. So I'm sure people will be aware that sex work is often unsafe. Between 60 and 80% of women sex workers have experienced violence, according to research, and they're more likely to experience it than men. One study shows that female sex workers are 12 times more likely to be murdered than other women. And in terms of locally, there have been 339 reports to National Ugly Mugs over this period, which we expect to be an underestimate. In terms of the types of harm that women experience when sex working, the largest proportion is physical violence, including sexual violence. Fraud and robbery is also quite common, as well as stalking and harassment. And something else we learned from the literature review was that sex workers use sort of a range of strategies to avoid these risks of harm. Interestingly, no one talks about the police within this. but it's more about kind of things they can do individually to manage risk. So working with other people, seeing regulars, doing sexual health screenings, changing locations, that kind of thing, keeping a phone on them. So health and wellbeing is the second sort of major area that was revealed in the literature review, with most studies suggesting that sex work is associated with poorer health and wellbeing, and particularly poorer mental health. And going back to that sort of scale of control that we were looking at a minute ago, the less control that women have over their sex work, the more adversely affected their health and wellbeing seems to be. With one study saying that on-street sex workers have extreme unmet health needs. So in terms of health needs, we can sort of think about these in a few different categories. Trauma is a massive one, something that we see every day at MASH. So many women who sex work have past experiences of trauma, but also sex working itself can be traumatizing, particularly when you don't have very much control over your clients or the situation. One study showed that 84% of sex workers had had a significant life event that made it more likely that they'd become involved in sex work. So something sort of traumatic in their childhood or youth. So trauma is a massive factor in terms of women's needs. Mental ill health is also a big need for many women who sex work. It's often untreated or undertreated, not diagnosed, and many women sort of self-medicate with alcohol or drugs. A lot of the time women link mental health issues to trauma, loss, violence, and homelessness. So there's kind of a lot of links between all of these areas, I suppose. Substance misuse is very common, particularly among certain groups of sex workers, those in the more survival end of it, often using substances. Less common amongst those with more autonomy over their work. As we said before, it's a common reason for people to enter sex work, and it's very much associated with trauma. In terms of sexual health, sex workers are at an increased risk of STIs and HIV. Research shows that just a third of sex workers regularly visit clinics, and on-street sex workers and those with multiple needs appear to have poor sexual health. And finally, pain. This was one that was more of a surprise to us, not something we'd kind of thought about a lot before, but physical pain is an issue for many sex workers on a day-to-day basis due to violence or untreated health conditions. So one study said that half of women were reporting physical pain due to clients. And this is something else that causes women to self-medicate, as well as the sort of mental health. So that's the health and wellbeing needs. Economic and employment needs. I suppose, you know, an economic need is what's driving women to sex work. Sex work is a way of earning money. It's a technique for managing financial need. Some of the reasons that people might have long-term financial difficulties, obviously they're very personal, but include things like ill health, looking after others' care costs, immigration status, homelessness, debt, and all of those experiences could be compounded by racism or other forms of discrimination. So definitely a complex picture, but the economic need sort of underlies all of the drive to sex work. And these are just some other ones that also came out of the literature review in terms of women's needs. So criminalisation, causing kind of issues and fear of arrest and prosecution, and that kind of affecting women's ability to seek support and work with others and that kind of thing. Immigration and trafficking, so again, fears around immigration and raids causing women to become more hidden in the way that they sex work and more at risk. Homelessness is a big one that we're very familiar with at MASH. So many women who are survival sex workers are also homeless. They often have multiple needs such as addiction, mental health and trauma, and we find it sort of difficult to separate out the causes and effects of homelessness and sex work, that everything is very interlinked. And finally, parenting. So many women who are sex workers are also parents. Some have care of their children and some don't, and that can be a big factor for them either way. So moving on to our primary research and the needs that we found as a result of that. I think we first wanted to sort of acknowledge that women who sex work experience a range of intersectional needs that are related to everything in their life, including their demographics, their experiences, class, citizenship status, substance use, homelessness, poverty, and more. So we're absolutely not trying to suggest that women are a homogenous group or sex workers are a homogenous group, but this is kind of what our research showed as women's needs. So we asked them about health and wellbeing needs, practical needs, and other needs. And this is kind of the number who said that they did need some support with that. And the most common ones were sexual health, general health, needle exchange, disability and long-term condition, practical help, substance misuse, hardship support such as food, clothing, toiletries, and safety. All but one woman who was surveyed said that they had some support needs, and on average women said that they had 7 different things that they needed support with. So quite a range of support needed. Interestingly, all of those things that kind of were most commonly reported can be seen as within the bottom 2 tiers of Maslow's hierarchy. So that kind of confirms that Maslow's hierarchy says, which is that, you know, those basic needs need to be met before any kind of longer term hopes or aspirations can be focused on. Or so that's a quick run through of the needs of women that this research came up with, and I'll go now on to services. So as part of the research, the 3 researchers kind of looked at what's going on locally in Greater Manchester as well as nationally. Many of you will already be aware we've got the Manchester Sex Work Forum, which brings together lots of people who are here, I imagine, lots of the key organisations in Manchester who work with sex workers. There are less structured arrangements in Greater Manchester as a whole, and as far as we're aware, in each borough. Similarly, there's a sex work strategy in Manchester, but at the moment not a Greater Manchester-wide sex work strategy. Okay, so in terms of accessing services, I think this was one of the kind of most interesting parts of the research that is very practical and usable for all of us who are working with sex workers. So we found out about how people prefer to be supported. And what came out a lot was that how support is provided is at least as important as what is provided. So the way that organisations offer support is extremely important to women. Women generally preferred face-to-face methods of those that we surveyed. So drop-in was the most popular, around 57%, and followed by outreach, and followed by regular sessions. And also people talked about preferring services on the weekends and in the evenings. So again, really useful in terms of how we can best meet women's needs. Also, what came through very strongly was about having the right people within organisations. Women said they wanted female workers, they wanted people they could trust and build up a relationship with, and of critical importance was not being judged by the service or the worker. So in terms of experiences of services, only 20% of the people we surveyed had actually used MASH, which was what we were hoping, because we were, we're trying to go beyond our usual service users and find out about the need across Greater Manchester and further afield. But in terms of those who had accessed MASH, most of them were Manchester residents, which makes sense, as that's where we're primarily delivering services. Some women reported positive experiences with various organisations. Some women also reported negative experiences, like having long waiting lists, services being hit and miss, and feeling that they'd been let down by the system, particularly the care system, and maybe struggling to trust some organisations as a result. In terms of experiences of MASH, they were overwhelmingly positive. So people talked about MASH having changed or saved their lives, helping them to stop taking drugs, stop sex working, find housing, access counselling. People talked about day-to-day practical help, social and activities going on in our drop-in. People mentioned that just having the outreach van of an evening provided them with a sense of reassurance and safety. And what really came across strongly was that what was important about MASH was the fact it was women's only venue. The relationships that they had been able to develop with staff and volunteers, and that they felt cared for and listened to, sometimes for the first time in their life. They also provided us with some useful suggestions for how we could improve our services, so that's very helpful. So then we went on to ask people about why they hadn't accessed support either from MASH or from other services. Some women said that they didn't need help. This was particularly sort of in-home escort and online sex workers. So perhaps having more autonomy and lower levels of need. Other reasons why people hadn't accessed services were concerns around confidentiality, not having services locally, not knowing how to access them, not being interested, not knowing what's available, issues with transport, and language and cultural barriers. And one of the stakeholders said that language and cultural barriers were significant and compounded by other challenges such as stigma and a lack of trust in services. So particularly for certain groups, accessing support can be very difficult. So I'll go on now to the gaps in services. So out of the, I think, 46 stakeholders that we interviewed, 2/3 believe that there were gaps in services for women. A very few thought that there weren't any gaps. That most people were kind of unsure if they weren't saying that they did believe there were gaps. The research review revealed a number of gaps in services. So I won't go through all of these in detail, but stuff around judgment and discrimination, services being conditional, so requiring them to give up sex work or drugs or alcohol, for example, before them being able to access support. Support services generally being unable to help women with their economic needs, so kind of unable to solve issues around poverty beyond kind of debt and benefits advice and stuff like food banks. Some services not reaching marginalised groups. Difficulties with accessing healthcare, particularly around being unregistered, not knowing where to go, not wanting to disclose information about the sex work. Stigma from the staff there, not being able to afford treatment, a range of things. In terms of the police, some of the research showed that there was fear of criminalisation, stigmatisation and a lack of trust, and that this is more pronounced amongst women who sex work of colour and migrant sex workers as well. And some around, women not being able to get the support they needed. So even after sort of requesting support, there being delays or just not being able to get it. So some quite significant gaps from the literature review. And then in terms of the primary research, in orange is the percentage of women who said they needed support with a particular thing, and in blue, the percentage who had been able to access it. So some quite significant gaps here between how many women were saying that they needed support and how many had been able to access it. So pretty much across the board, across all the different types of needs, there were gaps between women who needed support and women who had been able to access it. So these are some of the gaps that were reported by the stakeholders involved. People talked about there being a lack of women-only drop-in centres outside of Manchester, and a lack of sort of comprehensive services for women who sex work, like MASH outside of Manchester. Sorry. Lack of affordable, safe accommodation across the whole of Greater Manchester. Gaps around mental health, particularly for women who are sex working and have experienced trauma, and services that are long-term and flexible to enable women to engage fully. And also, again, multidisciplinary services that can support women with high levels of need and be able to kind of support them in different ways simultaneously. So to summarise those gaps in terms of what was reported by stakeholders and women, as well as the literature review, so support with sexual health, general health, needle exchange, disability, substance use, practical help, dental care, counselling, removing barriers to access, particularly around confidentiality, inability to access, lack of awareness and language and cultural barriers, housing, flexible, accessible long-term mental health services, and comprehensive multidisciplinary services like MASH, particularly outside of Manchester, and women-only drop-in services, again, particularly outside Manchester. So those were kind of the key gaps that came through from the research. So we'll go on finally to the strengths. So as Annie mentioned, we were quite unique in asking women questions about their strengths. So we asked, what makes you happy? What do you enjoy doing? What are you most proud of initially? These questions weren't answered by everybody. I think some people found them quite difficult to answer, quite emotive, and some people also said that they were really grateful to have been asked them, and they didn't often get asked these type of questions. So in terms of the what came through, the most common response in terms of what made people happy or proud was their children. So despite the fact many of them didn't have care of their children, they still felt very proud and that their children made them happy. Spending time with other family members and friends, doing art, creative activities, cooking, reading, these also came out. And also people said they were proud of getting clean, securing permanent housing, moving on from sex work. A couple of people said they had nothing to enjoy or be proud of, sadly. And finally, we also asked women about their sort of hopes and dreams, ambitions for the future. So this word cloud kind of sums up the main themes that came out of their answers. So again, the number one sort of ambition for the future was connection with children. Second most popular goal was around getting safe and secure housing. And thirdly was becoming and staying drug free. So this is hugely helpful for us because it tells us what women's main aims are, and that sort of has helped us hugely with putting together our new strategy, focused on what women actually care about rather than what we're saying their needs are or services are sort of focused on. So those are the key ambitions of women. I think that's my last slide, so I will stop sharing and hand back to you, Annie.
Amazing, thanks so much, Bea, and well done for kind of getting through that. There's quite a